Happy Thursday. It's Too Large and a Sarge. I'm Nancy.
I'm Tegan.
And I'm Sam. And remember, our program's rated R. Real people, real topics, and real life.
And you can catch us Monday through Friday at 7 a.m. on Facebook, YouTube, or SoundCloud.
Well, welcome back.
Thank you. Yeah. I was on a little bit of a vacation yesterday. Not really, but... and I listened to the show, though. And you guys were discussing the Canadian model with the eye tattoo.
Ugh.
Old purple eye.
Old purple eye. And I immediately thought to myself, isn't Canada
Self?
Self? I said self. Isn't Canada supposed to have like a centralized healthcare system? Why does she have this GoFundMe page if the Canadian government pays for it? If the Canadian healthcare system is so great, why does she have a GoFundMe page to pay for her medical expenses?
Well, I wonder if it's because it's basically self-inflicted. Like, it wasn't like it was cosmetic. It's not.
I can't imagine that it's not covering everything, though.
I wouldn't cover it. I wouldn't cover it.
It's
not like
Let's see here. Let me look.
Like, I don't think they'd cover. Say somebody had a Michael Jackson nose surgery and their tip of the nose that they had left fell off. I wouldn't want to pay to doctor that thing up. Well, if you paid for plastic surgery to get it done, go pay for a plastic surgeon again to get it put back on again, I guess. I wouldn't pay for it. I wouldn't cover it. If I was health coverage, I would deny it. Not for that. Not for a purple eyeball. A pussy purple eyeball.
So it says, Canadian healthcare basically works like Medicare, but for everyone. Medical care is free. It covers almost everything other than prescription drugs, glasses, and dental care. I guess most of the people over there have supplementary insurance to cover those other things.
So they're still paying for insurance then, to some degree, but
some degree, but not the major medical
drugs that she had. She wanted paid for.
Yeah, maybe she didn't have that insurance.
No, I wouldn't pay for that. I wouldn't pay for her eye care.
No, I wouldn't either. That's self-inflicted.
Like, yeah, that's what I'm saying. There's a difference between having an accident or something.
Things that are self-inflicted that regular health insurance covers. You drink and drive and you go down the road to get in your wreck and you're in a wreck. You go to the hospital, your insurance pays for it.
That's true.
Yeah, but that's an accident.
No, it's not.
Well, no, not if you drank.
Drinking and driving isn't an accident.
Yeah, not if you drank.
No, it's something that you've done yourself to make the incident happen. But I don't think. Here's what I'm getting. Here's where I'm getting at. You don't intentionally go, okay, I'm going to drink and drive, and then I'm going to get behind the wheel of a car, and my intents are, as I drive this car, to smash myself up in my car.
No, but that's...
But the purple-eyed chick, she's like, I'm going to put a needle inside of my eyeball and inject ink into it.
But I disagree. I think it's the same thing. You take a drink and you get behind the wheel of a car.
It's the same thing.
It's the same thing as sticking a needle in your eye.
Well, then don't treat those people either, then.
Who aren't we going to treat, then?
I say, nobody. Self-treatment. Self-medicate.
Self-medicate.
Well, that's the Canadian. I didn't really look into it too much. I just assumed that the Canadian government paid for everything. It's the way everybody talks. And the healthcare that we have in our country, I don't know if we need to regulate it, or I think it's way out of control with these prescriptions companies making as much money as they do.
Oh, absolutely. It's disgusting.
Like the whole EpiPen thing that was going on with the bee stings and everything else. There was like a 200% markup on it, and they were the only company that made these things.
Listen, if you are a recovering addict and you can get your medicine, quote unquote, your medicine to try to treat yourself, then if you are a diabetic or if you have any issues like that, then it should be covered. No questions asked. You shouldn't have to pay for that.
I'm not 100. Like, I know I've seen a lot of things going back and forth on Facebook about, like the Narcan and like the treatment that these people get, recovering drug addicts. Like, I don't think it's all free. I don't think.
I've seen the people that go to these methadone clinics.
Yeah.
They're not functioning people of society. They don't have jobs. They don't have health insurance. They're not paying for this.
The recovering addicts, what kind of stability do they have financially? I can't imagine them having a lot of money.
There used to be a methadone clinic right down our road here by Sheetz, and you'd go to Sheetz in the morning.
Oh, I bet Sheetz in the morning was good. Ooh.
Send me into a fit of a murderous rage. Because these people can get up in the morning and go and get their fix and then go sleep it off all day, but they can't get up in the morning and be a productive citizen.
And go work.
And go work and everything else.
Okay, so there are private clinics that aren't free, but public methadone clinics are government funded. And they actually have a waiting list. And
then I think other things
generally paid for by us, the taxpayers.
Yeah. Well, then I see that's where I say way to go Canada with their health coverage. I think it should be that way here. I don't want to turn this into a political conversation, but I had big issues with previous health coverage because here it is. Riddle me this. Try to help me figure this out because I still can't get it to this day. So they want everybody to get health coverage, but if you can't afford it, they penalize you and take it out of your income tax and they don't give you health coverage.
Right.
Well, how about this? Why don't you just give everybody health coverage for the people that can make payments every month, give them a discounted rate every month, and for those of us that have to pay for it once a year out of our income tax, jolly well give us medical coverage and just have us pay it a 10% higher premium rate.
Right.
But we have to pay it all and be penalized all at one time. That doesn't make sense. So you can't afford health coverage, so we're going to make you pay for health coverage once a year.
So why not? Yeah. So it makes more sense. Yes, just give it to us.
Give it to me.
Right.
Okay, I'll pay for it once a year. Mm-hmm. At least I won't have that worry on my hands if an accident would happen or something would I get sick or something.
Right.
And what really makes me mad is most of the people that couldn't afford it were working citizens. So here it is, we're working to pay for the people that get their medical coverage for free. And I'm getting sick and I'm worried about putting nickels and dimes together to be able to afford the copay for a doctor appointment. Well, not even a copay, to pay the full appointment price.
Right.
And have to worry about paying for my prescriptions as well, too. But I'm the one working for everybody else that's getting it for free. There's no logic or no reason behind it.
No, absolutely none.
Absolutely none.
And the people that make up these laws and stuff, I mean, they're not sitting where we're sitting.
No.
And they haven't been sitting there for so long that they don't get it anymore.
Just make it universal.
Yes,
really, just take the pain and the misery out of it and just make it universal.
Because it's not like we use it. I mean, we have to pay for it all year, or in the companies that we work for have to pay for it all year. But it's not like we use it all,
No. Plus, I mean, part of our government should be to want to take care of its citizens.
Right.
Take care of us. Help us out here a little bit. I mean, some people are getting everything and then some on top of it, Like, why does a person sitting on their ass every day deserve medical coverage, but a person working sometimes 2 jobs or families where there's 2 jobs or sometimes 3 jobs? Like, why are we being punished?
Right. I remember when, when we worked for the first radio station that we worked together, I had myself on it before I got married, and my daughter had CHIP because, she could. And my significant other at the time, he didn't have it because I couldn't afford the 2 of us, much less 3 of us, because I know, some of the guys that we worked with had their whole family on their insurance. And it was pretty much a whole paycheck.
It was a whole paycheck. I think it was I can tell you right now, the place I work at now for health coverage is for a family for $700 or $800 per month.
Yeah.
I can't afford that.
$400 a paycheck.
Yeah, I can't afford that.
And it's and I'm going to talk about the healthcare coverage in the United States here and everything that's been going on in the last couple of years. And I'm not going to call it by the name that the media calls it by. I'm going to call it the Affordable Health Care Act.
Right.
I'm not going to call it Obamacare because I don't want people to think that I'm just against it because Obama came up with it.
Right.
Right.
It's called the Affordable Health Care Act. And these morons that are against Trump and his views on it, saying about, there's going to be so many people that are without health coverage and everything else. There's only 10 million people enrolled in this out of 300 and some million in the United States.
Yeah, and that's nothing.
That's nothing. That's a drop in the bucket. So everybody who had insurance or needs to pay for their insurance, it's no longer affordable because the rates are through the roof.
Right.
Yeah.
It's only affordable to the ones that were getting it free anyway.
Yes.
Yeah.
0 is 0, whether it's a Affordable Health Care Act or not. They were still paying 0. They're still paying 0. It doesn't make any sense to me.
Right. We just need to remedy this whole thing by just making medical coverage universal. Make everybody have it.
Absolutely. And we need to have everybody, if we're going to have the same health care you and I are going to have the same health care. The senators, the president of the United States, everybody has to have the same exact health care coverage. Not because you're a lobbyist and you get paid these big bucks because you're funding, you push laws to help the doctors or the health care or the prescription and you get better coverage. No, let's go straight across the board. Everybody gets the same coverage.
Yeah.
Regardless of social status.
Right.
I agree. Like the keep it simple, stupid philosophy on things. We all need medical coverage. And I just think, I'm repeating what I just said before, but I really hate the fact that the people that are being out in the world, being productive, we're scraping, we're struggling.
Absolutely.
For something as basic as, I'm not a hypochondriac. Maybe once a year I'll get really badly sick and I'll need 10 days or 12 days or 14 days worth of amoxicillin. By the time I'm done doing that and I have to pay out of pocket for everything, it's ridiculous. That's food off the table for my family because of it. And I'm the one paying for other people that get shopping carts full of food. And I just think it's weird. I think it doesn't make any sense. I like things that are logical. And the way that this health coverage has been going is just not logical. It doesn't make sense.
So I just put some fake information in the Affordable Health Care Act to get some rates. So, the lowest was Humana. A doctor visit's $60. Co-insurance is $60.40. Annual deductible is $6,000. Max out of pocket is $6,000.
Wow.
And the highest, which is First Health, which is $410.34 a month. You can choose any doctor, guaranteed acceptance, no annual deductible, and no annual maximums.
It's ridiculous.
People can't pay $400 a month and still survive.
That's close to my house payment.
Right.
I mean, who...
Take care of your citizens. Keep them healthy. Keep them well. I mean, take care of your people. I kudos. Kudos to Canadians. I'm happy for them. I think that's absolutely fantastic. I do. I think that's great. I think we should have it.
Yeah, I think so. I think we should do, have it also. I don't think she would give the credit to the Canadian government because I hate Canadians. But
now?
No, not now. They're horrible people. It's another show.
Tell us how you really
wool
feel.
sweater wearing, bearded, horrible people. So I just looked up to see how much the Highmark CEO made for their salary last year. Oh, they only made $7 million. That's all.
How could you survive?
That's terrible.
Where did this all get out of control? Did it? I
don't know.
Is it the hospital charging $100 for an aspirin, or did it start somewhere else? The cost of coverage is so high because these prices are out. If you get an itemized list of your hospital stay, it'll blow your mind.
Oh, let's not talk about it.
Oh, yeah, that's have a baby.
Took the words right out of my mouth. I have had 3 children. Thank goodness I've had medical coverage of some shape or form take care of it for all 3 of my kids. But let me tell you something. They send you the bill regardless.
Yeah, I know they do. What is it, the EOB, explanation of benefits?
Oh, I'm telling you, the breakdown is enough to make you very thankful that you have coverage at that time. Because they do. They charge you for every Band-Aid, every
Sharpie that wrote on your belly or whatever.
Yeah, everything. So it's pretty ridiculous. I just think we got a lot of stuff twisted in this country. Why is it so expensive, like you said before, for items that people need to live?
Yes.
To live.
Life-sustaining.
Yes.
Yeah.
It's not no, it's not. This isn't...
Diabetic supplies and catheters. And
My dad was just on the phone today talking because my stepmom's going to be retiring next year. And, he was on the phone with... It had to have been a health insurance company talking because he has a pump. And it's horribly expensive.
You shouldn't.
For the insulin. I was just looking up to see base pay for on average family practitioners, pediatricians and psychiatrists, which are actually the lowest of all physicians. It's $189,000 a year.
You can do all right on that.
Oh well, yeah.
You can do all right on that. You're fine.
But I mean, that's just base.
And well, let's go to them having to pay so much for medical school. You know, why don't they cut them some slack on the medical school?
Sure.
They're saying there's a lack of doctors, and I don't know the exact story or exactly how it works, but I'm going to break it down how I understood it, that my sister explained it to me. They're saying they're down in numbers and they need doctors, but only a select few get residencies every year. Not everybody who graduates medical school gets a residency.
Right.
There's only so many slots.
Right.
Does that seem like a problem to anybody else? Like, why not give these cats residencies so they become doctors? They were shortest of doctors.
Yeah, you think if you're
I wonder how that's controlled. Like, who picks that there's only so many that get to have residencies? Like,
I don't know. And then all these doctors go, or future doctors go, and they interview at 20, 30 hospitals all around the country trying to get a residencies. That's out of their own pockets, out of everything.
And I mean, no offense, and this is not, I'm not being negative whatsoever, but 3/4 of the doctors that I have gone to most of my life have not, I mean, they're not of, how do I say it without sounding like
They're foreigners.
Yes, thank you.
They're foreigners. They pay $29 total to get their medical degree. Honestly, that's all they pay.
Seriously?
They don't pay too much.
I looked up the median 4-year cost of medical school, including expenses and books, is $278,000 for private schools and $207 for public schools. And this was back in 2013. And this is according to the Association of American Medical Colleges.
It's ridiculous.
So, like, it doesn't make sense. I mean, these are people that we need. It's not like, we don't need we need doctors.
I don't get it.
No, logically, it doesn't make any sense.
No, none of it does. That's why I get so frustrated with the whole thing.
I mean, a pharmaceutical rep makes more than a practitioner.
Yeah.
That's insane.
Yeah. Put that in your pocket. That's disgusting.
Well, don't get me started on all of that either, though. Let's take a look at, we could get into a conversation right now, things that aren't fair. I'm talking about what soldiers make versus superstars. Ooh. People protect our country, and, you've got celebrities racking in millions of dollars.
Yes.
Like it's
disgusting.
Well, there's a lot of people that say that, and me being a combat vet, I never seen it that way. I wasn't doing what I was doing for the money.
No, and that's...
some of it I was doing for the benefits. One of the reasons I signed up is to go to college. One of the reasons I signed up is to have money. But it wasn't like I'm seeking fortune and fame and I'm thinking I should be getting paid millions and millions and millions of dollars because I'm putting my life... We don't see it that way.
You don't see it that way, but I'm talking just assessing it by levels of risk. Like military men, firemen,
police officers,
like they should be paid at a way higher bracket because they are putting their lives at risk every single solitary day. That's worth something. Your life is worth something, and I just find it, a little bit crazy too that's the way our world works.
Yes, so an average total income for a pharmaceutical rep is $127,000 a year.
Wow, that's a nice chunk of change.
And that's pretty good.
$60,000 under a doctor.
And far less stress.
Well, I mean, sales is sales. I mean, they just happen to be selling things that people absolutely need.
Yep.
Do you need a car? No.
No.
Do you need jewelry?
No.
No. Do you need clothes? Do you need the other stuff you go to the mall for?
Some of us need
clothes.
Well,
some. I mean, you know what I mean. You don't need all the clothes that you have.
Oh, no, of course
not.
not.
Do you need medicine to survive?
Yes.
Yes. It's an easy sell.
Yes. But I don't think we need all of the medicine that's pushed upon us.
No, we don't.
No.
We don't. And even if it is pushed upon us, we don't necessarily have to pop it in our mouths.
No, but I think that's the solution for a lot of things nowadays, though. I do. That makes me nervous.
It is.
Like they want to hurry up and, just pop a handful of stuff into, people's systems. And maybe part of the problem is instead of masking the actual symptoms for some of these people's issues, why don't we just deal with them?
Yeah.
Like, I think
get to the bottom of the problem, right, instead of...
And I'm thinking, like emotionally and stuff. Don't get me wrong. I think some people with certain issues need to take medicines to level themselves out and stuff like that. I'm not saying that. But in some cases, maybe these people are just taking it because they just don't want to deal. Like, they're not using their own coping mechanisms in some cases. And it's easier just to... It's almost like the addict. Pharmaceutical dependence is no different than a heroin dependence or no different than a cocaine dependence or anything like that.
And I think sometimes depending on your doctor, unless you've got a really good doctor that likes to actually listen to you, they are quicker to prescribe you something.
That's what I'm saying.
Everybody is. A few years ago, I hurt my neck, and it still bothers me to this day. They sent me to the pain clinic, and once I realized, I was clueless because I've never dealt with that. I thought they were sending me to a specialist that I'm going to get my neck fixed.
Right.
Well, he started saying, "Well, they're going to drug test you once a month," and I'm like, "Wait a second. What? Well, we're going to give you." I was like, "No, I'm good." I left. They weren't going to fix the problem. They were going to mask the problem.
Yeah.
And that's a choice I make. Now, if anybody says, well, the doctor prescribed me and everything else, well, if there's a loaded gun in a corner, it doesn't mean you have to walk over there and you have to shoot somebody.
Right. But, if it's for something, and sometimes people just aren't smart enough to differentiate any of that. But if it's something, like with me, I don't have a thyroid, so I'm always hypo, however the hell you say it, I can't even say it. So there's a lot of things that go with it. And it's a constant battle with me going back and forth with my doctor saying, hey, I'm losing my hair. Hey, I feel like crap. So there's other prescriptions that she's given me to help with that. And I just think that...
It's too much.
It is too much.
It's too much. And I'm not saying that there's some mental issues. Like, I'm not saying people with emotional issues or mental disabilities shouldn't take medications. I'm not saying that at all. I just think it needs to be very, very carefully assessed and evaluated before a pen and paper is out. The little scratch, the little notepad that they write their prescriptions on. I think that they really need to talk. Because I see some people in this world that... I see their lives and I see how they handle it, and they're just not problem solving. They're just not being an adult and taking their circumstances in their life and finding ways to overcome some of their issues.
Right.
It's like the woe is me. If I didn't have this and that, I wouldn't be on welfare. I wouldn't have this and that. No, if you got off your freaking ass, applied for some jobs instead of complaining about it, maybe you wouldn't be, maybe you wouldn't be in these circumstances. Maybe you wouldn't feel blue. You gotta be proactive to some degree, and you've got to be responsible for yourself to some degree. Now, in other cases, I have PTSD. Two of us at this table have PTSD. That's kind of a different thing. It's different. And one of us is medicated, one of us is not medicated for it. And do I feel at times that I probably should have? Yeah. I'm being 100% serious.
Right.
I think that I should have it because with a circumstance like that, sometimes certain words or certain
triggers. There's triggers.
It triggers it, and I can't control what how my body reacts to certain things.
Right.
Like all of a sudden, it's a physical response. Okay, I could get medication for that. I probably should be medicated at times for it. Right? Don't nod your head.
Sammy's nodding.
But at the same time, I don't want to be a person either. I think for the most part, I can say 90% of the time I cope well with what I have. So do I feel that I necessarily, for that other 5 or 10% of the time, need to regularly on a daily basis take medication for it if I feel that I'm coping 90 to 95% of the time? Well, no, I don't feel that I need that.
Right. And
I don't.
I think people can determine that on their own, but I think there's just a lot of people obviously that abuse it. And you were talking about the welfare system. Pennsylvania is hideous.
Loaded.
For the welfare system.
It is no longer help. It is a lifestyle.
Yes. Now, quick story.
I think I know this story.
My ex was in line behind a, I don't know, husband, wife maybe, but they had their little boy with them, and they had a cart full of food, and then they had a cart full of other things that There was stuff for the little boy specifically, and then he could tell there was stuff specifically for the parents. And they ran the card after they paid for everything, and apparently some money was there, but not all the money was there, and they put the stuff for the little boy back. And the mother of this child physically looked at her son and said, "Honey, your paycheck is not here yet. We have to put your stuff back."
Wow.
Now, Justin being who he is, I'm surprised he didn't, like, heave the whole cart at these people. But he didn't say a word, which I was really surprised, but he has told that story over and over again. But to look at your child and tell them that the government money that they're getting, because these two lazy...
That's their paycheck?
That's their paycheck?
Oh.
That is unbelievable.
Boy, that's interesting.
I've known people to actually, their one child got tested and they were a little slow, so they were getting Social Security for this child. Well, they got their other children to be tested, and they were slow also, amazingly. And they had a swimming pool, they had a brand new car.
Wow.
I mean, it was horrible.
Oh, yeah, I know entire families where they all go on SSI.
They all go on
Every
SSI.
one of them.
I don't know how that works. Like, how...
You just pretend that you're dumb, you know? You do.
Okay.
Like, you just pretend that you're slow.
That you're slow and
Or
you're...
you act
and you're,
crazy and stuff, and you just get it.
I haven't gotten it yet. I've been acting crazy for 41 years, but I still...
No.
And I want it to be said, have I ever got food stamps in my life? Yes. I did that when I had recently become, at a point of time or so, a single mom. But at that time, I was going to school to try to better myself. And in the meantime, I was still working a part-time job. And, I'm trying to juggle school and work and all of it.
I mean, and that's not what we're talking about. Like, we're
Right.
talking about the people that this is their lifestyle.
Exactly.
It's called assistance.
Right. And there's a reason why it's called
You've paid
assistance.
that back
Yeah, tenfold.
Oh, well, yeah, you
tenfold,
have to.
100-fold.
Absolutely.
Yeah.
by now
Yes.
because you work.
Yes.
So I don't have a problem with the usage of the public
No, not at
welfare
all.
system.
Not at all.
When you need it, you need it. People
Right.
have bad times. People have bad circumstances in their life.
Right.
That's why
That's different,
it's life.
though.
I mean, it's not
Yes.
easy all the time. I don't have a problem with that. But like you said, I knew that story because I remember hearing that story from you and I think from him several times. When you're referring to free money for yourself from the government as a paycheck,
Yeah.
I'd like to hit you right in the mouth.
I know.
And not one of the ones where I do an open hand so it makes a real loud noise. Like I want to
Right in the
ball up my
throat.
fist and
Throat
You better
punch.
hope your free healthcare has good dental coverage.
Yeah.
Yeah.
And that's why I was really surprised he didn't say anything, because like he's more vocal
That's
about
horrible.
things than we are.
That's horrible. And I've heard people say back in the years they used to have what was called, I guess it was called CWEP or something like that. It was when you were on welfare. It was a work for your welfare sort of program. They would assign you places to work. And they still looked at it as if they were like earning that money. Yeah, I'm glad they're putting you out in the streets. I'm glad that they're giving you a place to work. But how about this? How about you just go out and apply
Get a real
for
job.
jobs?
Yeah.
Because you're still getting how much of that, handed to you. You're still getting so much of it for free. Like, if you're going to do that, then why don't you just apply for a job and work?
I
Well,
know.
if-
Come on.
If you drive south and you go through South Carolina, their roads, the sides of the roads are the cleanest state I've ever been in, but they have the welfare work system. Mm-hmm. And they make them go out and they clean the sides of the roads and they do public service.
Well, good.
And they earn their money. I mean, I'm going to say it gets hot down there in South Carolina. Once you start getting below Virginia, you get North Carolina, Southern North Carolina, South Carolina, Georgia. During the day, you don't see a lot of people because they're in the house because it's with the AC. Because it gets stinking hot and humid down there.
Humid, yeah, the humidity.
But they have them out. You can drive through and you see crews picking up garbage. And here you see it here, and it's prisoners. Well, it's not down there. It's welfare recipients. They make them work for their money.
I just get tired of some of the things that I've seen. Part of my life I spent working in retail, and part of that time, I've been management since the time I was 20 years old. So part of my responsibilities would be to help hire. I would assist in the hiring process. And nothing has pissed me off more than, and I'll tell you what I did the one time. Nothing pisses me off more than when they come in with their papers. Okay, well, I'm here because I just need you to sign this paper because they want me to go out and apply for jobs. Well, the one day I had had enough. I had had enough. I said, you're here. I'm not going to sign that quite yet. Here's an application. I'd like you to take a few minutes and fill it out. We're actually hiring right now. Oh, yeah. I'll sign that. I need you to fill it out. And I put them through the interview. Because I'm thinking, holy crap. So you just go into a building and get a paper signed for a place that you clearly, and it was some dude, freaking stoned out of his mind, completely tweaked out of his mind. Hey, I need you to sign this. Like, no, you're going to work for this. If you want my signature, you're going to work for it. You're going to fill out my application. You're going to interview with me. And then I'm never going to call you because you're worthless. You're a piece of junk. I mean, clearly, you're just floating around like a turd in a toilet bowl. But I still at least made him work for that signature on there. Like, it makes me so mad. I know that might be a little extreme, but hey, I don't sign this piece of paper because I need to get some food stamps and some free cash this month. No, go F yourself.
Yeah.
Go F yourself.
I don't think it's extreme. Honestly, I don't. Like, there's so many entitled people now. Like, it's
I know, it's terrible.
But they look at it at the end of the day, like he will go home like, I worked.
Yeah.
I worked really hard asking, like...
That's the problem. And they're creating generations of it.
Don't come back. Hit the road, Jack. Don't come back no more. Because if like, don't come to me then. Don't send your friends here. Don't come to me. Don't waste my time as a citizen that's helping to pay for you. Don't waste my time with that unless you're really in here to apply for a job with me. Like, that just aggravated me. Just aggravated me.
And there's lots of companies, like even CareerLink, they offer on-the-job training. Like, they'll pay you, like, a wage to train you and to get you a job.
Sure.
Like, it's ridiculous. It's not like there's not plenty of things out there. My gosh, you can do something every day to better yourself. Whether it's education, look how many, like, Indeed.com, Monster.com, RegionalHelpWanted.com. There are so many jobs that need filled.
I know. Well, that's what irritates me. Like, of course, they're making it a lifestyle, and that's why they come in half-heartedly, handing me a piece of paper, and like their mommy, I need to sign it for them.
Are you required to sign it? I mean, like,
I'm not required to do anything. Yeah. I'm required to tell him to get his ass out and go to another store and get them to sign it, because I'm not signing it.
But somebody will.
Yeah.
I know somebody will, but at least I can go to bed at nighttime knowing that, at least that dude had to go through the whole process. Oh, you're going to come in and you want to talk jobs? Good. I have a position. You could be my stock boy. That's great. Come in and I'll sign your paper, but we're talking. Like, come on. Quit wasting time. Like, I mean, and I'm a different breed of person than half these people that come in here and do these things. Because if I was getting full assistance, cash, and food stamps, my goal in life would be to not be on food stamps and cash assistance anymore.
Yes, because it's, like Sam said, it's assistance. It's not a life.
I wouldn't go from store to store that I would have no interest whatsoever in. I mean, there is a job, like you said, suitable for somebody out there.
Absolutely.
If you want a job where you don't want to have to exert a ton of mental power, then go find a job where,
you're washing dishes.
Something, where it's just it's a routine process, and you can, sure.
You'd mentioned Indeed.com, and these people have no reason not to get a job.
No.
Okay, they can say, "Oh, but I don't have access to a computer." I say, "Phooey."
Go to the library; it's free. Nope. Go to CareerLink. How about your cell phones that you got paid for?
That's what I'm talking about. You go downtown Johnstown to the soup kitchen. There's always a line down there, and every single one of them has a smartphone in their hand, and every single one of them has their smartphone out, and they're playing on their smartphone, and they're doing whatever, waiting for free food. So don't say you don't have access to Indeed.com. And if you've never used Indeed.com, sign up. Put your type of the crappiest resume that you can think of.
Yeah, because Indeed, their resumes are terrible.
You'll get offers for at least interviews. Mm-hmm. You'll get job offers on the spot. Okay, yeah, come work for us. Right. And a lot of these companies are paying above minimum wage.
Yes.
They're paying $3-4 above minimum wage to talk on the phone or to do this or to do that.
Yep.
Yes.
But it's hard. It's work. You got to get up. You can't slam heroin into your veins. You can't just sit around and do nothing. You have to get up. You got to shower. You got to put on clean clothes, and you got to go to work. And people don't want to do that.
No, that's what upsets me. That's what upsets me, and that's why that day I said, you know what? I will sign your paper, but you're filling out an application. Because guess what? I need somebody in my building. But because of people like you, I don't get anybody. Because they just want to keep hanging out and getting their signatures on a piece of paper and go back home and sit on their ass all day long.
How old were you when you first started working?
Getting bills handed into my hand, I was 10 years old. I started babysitting at 10 years old.
How about you?
I had like a couple odd jobs when I was growing up, but mainly I played sports year round, and my mom loved watching me play sports, so I didn't have to get a part-time job. I didn't need much, but I joined the Army National Guard when I was 17 years old.
Yeah.
I went there. It was 1 week in a month, but I was still in high school. 1 week in a month, 2 weeks in the summer, and then I went to college, and I've been working ever since I've been 20 years old.
Yeah.
You know.
Yeah, I was 15. My first job was McDonald's. I was the drive-through runner.
Fun.
No. Not fun. Oh. But yeah, I started when I was 15. And I've worked ever since. But
I need to work. I need to get out of the house. I can't sit around the house.
Yeah.
It drives me crazy.
And that's what throws you into depression. That's probably what makes you want to take drugs.
Right.
Is because you're sitting around all day long. After a while, it gets really, really boring.
They're up all night doing whatever, and then they sleep all day, and then they're up all night.
I don't know how people function with that. You know, I have a daughter. I've got responsibility as far as that. You know, you can't become a non-functioning member of society, at least not in my book.
And of course, I always want to make sure I'm politically correct to some degree. Mothers, full-time mothers with children, you are included in the working
absolutely
people.
They are.
Absolutely
they are.
100%.
If you are a stay-at-home mom.
Full-time mom.
I'm not talking a single parent that refuses to work.
Right.
And works with assistants. I'm talking your husband says, listen, chick, I'm going to work. You stay home, raise the kids, make food, and clean the house. Right. That is your job.
Sure, and that is
not a 40-hour-a-week job.
That is a 24-hour. That's
a 24-hour
a day, 7-day-a-week job.
Yeah.
So full-time moms, we give you full, props. That's a totally different ball of wax. We're talking the excuse makers, the oh woe is me's, the victims. That's what we're talking about here. So, we really. Where else do we want to go? What other topic do we want to tackle and go to SmackDown?
I don't know. Question of the day. What?
Wait. What did you want to be when you grew up? What did you want to do with your life?
I wanted to be a fighter pilot.
Did you?
Yeah. Or an airline pilot. I wanted fighter pilot into airline pilot.
Yeah. How about you?
I had a couple routes that I could have went. Of course I wanted to be a famous actress. I wanted to be a superstar. I can't imagine that. I love theatrical arts. That, psychology, or the police academy.
Oh, nice.
And to be a state trooper. Yeah. But see, I think I would have taken, if had I not got knocked up at such an ungodly early age, I think if I would have went to college and taken psychology courses, I would have just started taking criminology-based courses. And I think from there, I would have been a freaking detective or something.
Yeah, that's really cool.
Still part of me wants to see if anybody needs help doing that detective stuff. Yeah. Like some of the local private eyes. I would love to work for them.
How about you, Tegan?
Me, I always wanted to be a zookeeper. Always. I didn't care if I had to just feed the animals and clean their pens. Yeah. I always wanted to be a zookeeper.
Aw.
What did you say?
Just cleaning up. Like,
that's because Sam's afraid of giraffes because he almost got eaten by one.
I didn't almost get eaten. I got chewed on by a giraffe.
How do you get, where were you at and how did this happen?
Okay.
Just quickly.
We'll end the show by me telling my giraffe story, okay?
Thank you.
There's a place down in Florida. There's a place down in Florida called Lion Country Safari. Uh-huh. And for most of it, they open up the gate, you drive in, they close the gate behind you, and there's all these African animals just walking around, and you drive in your own vehicle. Mm-hmm. They have lions there, but they're behind something. They even have rhinos out, out. Like, you drive past a rhino, like, that's a rhino. So you get to the end, and they have the giraffe enclosure. Well, you get out of your vehicle and you walk up this big platform. It's a big platform up there, and it's got a big brass railing around there and everything else, and you buy crackers.
Ooh, crackers.
And the giraffe come over and you feed the giraffes these crackers. I personally have never pet a giraffe before. Mm-hmm. I was insistent that I'm petting this giraffe. So this big male giraffe comes over and he leans in to eat a cracker, and I reach my hand out and he stops and he backs up and he kind of gives me a look. So I put my hand back down, hold the cracker, he leans in again. I reach out my hand again. I'm going to pet this giraffe. He backs up. We do this dance for about 5 minutes, right? So at one point he even looks at me like, you know I'm a giraffe, right? Like, I can just look at this giraffe's mind. Like, in his eyes, I could read his thoughts. He's looking at me like, you're a special kind of idiot, aren't you? So we get all done feeding these giraffes these crackers, and I'm talking to my family there, and I have my hand on the railing, and I feel this pressure on my hand and this tone because of the big brass rail that goes around. And I look, and half my forearm down is in this giraffe's mouth. And he is clamped onto me. I mean, he is clamped onto me. And I finally pull away, and there's just slobber just dripping off my hand.
Think about these crazy long tongues.
I know. And this giraffe turns around and just walks away so smug and arrogant. And meanwhile, there's a lady standing there just holding a baby. She goes, oh my God, that giraffe just bit that man. So I'm standing there, and this poor little, she had to have been a high school girl just working there. It was in the summertime. She comes over, and I yelled, I said, giraffe just bit me. And she's almost in tears. I said, no, I'm just joking around. I said, is there someplace where I could go wash my hands? There was red marks. There was no teeth marks, but there was red marks, and I got bit by a giraffe. No kidding.
Well, it's pretty sad that he knew the rules, and he's a giraffe, and you don't know the rules.
There was rules, schmoes. There was no signs up says, do not pet the giraffes.
That poor giraffe says there's one in every crowd.
Well, they let you give him crackers, so you should be able to pet him.
Like, look, watch everybody else. He's probably looking around going, look at everybody else, fella, okay? Look, one hand up, a cracker. Hey, maybe even two palms out with crackers in them. What are you doing? What kind of cat are you?
And they've got, like, big old cow teeth.
I still never got to pet that giraffe.
No.
If I ever get a chance to,
How many people? Tegan just brought up a picture of a happy little woman with big old tongue out.
They're not happy, they're evil.
Oh, no. They look like big old long-necked cows. They're so cute.
No, they're horrible.
Listen, how many people left that park and could say your story? How many people think,
that's a fantastic story.
I have never met somebody or heard of somebody getting bit by a giraffe.
No, you're like the only one I know, and I think it's fantastic.
Like, you watch TV, like, they make programs about people getting mauled by a grizzly bear. Big deal. I got chewed on by a giraffe.
That's nothing.
That's nothing.
You ain't bad.
You ain't bad.
You ain't nothing.
I can walk around like an idiot and get chewed on by a grizzly bear. It takes somebody special.
Real
dedication.
Special.
It takes true dedication to get chewed on by a giraffe.
That is amazing.
And that's another episode of Too Large and a Sarge.